This is Andy Schumann from Gizmos with another tabletop tech review. I have an article that will be published in Contemporary Pediatrics in the May issue dealing with vision screening and update, amblyopia and strabismus detection with retinal polarization scanning. So I wanted to review the new device that has recently been introduced to the market that has the potential for significantly improving the detection of amblyopia and strabismus in pediatric patients. The reason why we screen for vision problems in children is that approximately 2.5% of all children have amblyopia. Amblyopia is poor vision, typically in one eye, that occurs when the brain does not recognize the sight from that eye, even if the eye is structurally normal. We have a limited opportunity to diagnose and treat amblyopia. Usually, kids respond well when they're diagnosed in the preschool years, and if treatment does not start by age 7, amblyopia may never improve. Children with amblyopia lack binocular vision and are likely to suffer from poor school performance, reduced motor skills, and impaired self-esteem. Amblyopia is a silent condition. It can remain undiagnosed and untreated unless children undergo vision screening. So in theory, children can be screened for vision problems with traditional eye charts by the age of 3 to 5. However, in practice, this can be difficult to do. So for the last 10 years, pediatric practices have adopted instrument-based vision screeners called photoscreeners, and I've reviewed several of these on Gizmos in the past. And these identify children with risk factors for amblyopia that predispose towards the development of this condition. Photoscreeners use an infrared camera that captures and analyzes images of the red reflex of undilated pupils to screen for things like refractive errors, astigmatism, anisometropia, which is a significant refractive difference between eyes, as well as strabismus and lens opacities. So I will reference a previous article I wrote that appeared in Contemporary Pediatrics in 2014, so you can review the subject. According to the guidelines of the American Academy of Pediatrics, visual acuity screening is recommended at age 4 and 5, as well as in cooperative 3-year-olds. Instrument-based screening using photoscreeners may be used at age 12 and 24 months, as well as at 3 through 5 years of age. And subsequently, vision acuity screening, usually using standard eye charts, should be done at ages 6, 8, 10, 12, 15, and anytime vision problems are suspected. Risk factor screening, however, has limitations. Amblyopia risk factors are very common, with a mean combined prevalence of 21% compared to a prevalence of amblyopia of 2.5%. Overall, over the last decade, photoscreening has improved the number of children diagnosed with and treated for amblyopia. If you look at the numbers, only about 1 in the 8 children with risk factors who undergo a thorough examination by a pediatric ophthalmologist will be diagnosed with amblyopia. Keep in mind that in my experience, approximately 1 in 10 to 12 kids refers on a typical photo screen, and of that number, 1 in the 8 children that actually get seen by a pediatric ophthalmologist have amblyopia, so there is a large over-referral rate. Part of the problem also is that less than 50% of children who are referred to pediatric ophthalmologists actually follow up and are seen by the ophthalmologist. To summarize, the current referral rate for photoscreening is too high, with a poor specificity for amblyopia detection, and compliance with referrals is so poor that many young children with amblyopia continue to go undiagnosed. So today, I'm going to show you this device called the Blinq, which was developed by David Hunter, who is the ophthalmologist-in-chief at Boston Children's Hospital. The Blinq device projects a beam of polarized light onto the retina, and the changes from the light reflected by the fovea of each eye are analyzed by the device. It performs 5 scans in 2.5 seconds, and the device calculates what's called a binocularity score A score above 60 indicates perfect eye alignment. A score below this indicates amblyopia, strabismus, or microstrabismus. The device is a gray orb, which is extremely easy to use. One can enter a new patient if one wants to input patient information, entering the patient ID, which can be the patient's age as well as information such as the gender, date of birth, etc. One can alternatively enter this information by way of a patient portal and upload the information to the device by way of the office network. What I prefer is to do a quick scan. So the device is this orb. The child looks at this central opening. When activated, the child will see a face etched into a mirror on the back of this opening. And when the user uses the device, one merely pushes one of either button on the handles, and it goes into what's called calibration mode. As illustrated here, you project the light onto the chest of the patient. It takes about 1/10 of a second. And then, as depicted here, you push the button again, and then you bring the eyes, or the target lights, into alignment with the bridge of the nose. So, hi! How you doing today, sweetie?
Good.
We're going to demonstrate a new vision screening device that uses something fancy. It's called retinal polarization scanning to check the alignment of your eyes, and it's easy to use. So I'm going to hand the camera to Brian, and he's going to help me out here. So you're going to see a face appear inside this opening, okay? So I'm pushing a button on the device. It's going to prompt me to do a calibration, and two lights appear on the chest, and then it tells me to scan, and I position the lights on the bridge of the nose such that they appear maybe a ½ inch apart, and you can see we got a pass reading within seconds, so it's that easy to use. Pretty cool, huh? Did you like the face that you saw? And thank you for being so helpful and cooperative. You're awesome. So, very nice device. It's about the size of a soccer ball. Easy to hold. I have found in spending some time with the unit that you need to have a cooperative child. I find that children who are 2 to 3 years of age are easily screened. They are instructed to look at the opening in the device, looking for a face. If you tell them to look at the face, they will tend to look at your face. So tell them to look at the opening. The results usually appear faster than with photoscreeners, and you can either print out results by way of the portal, or more simply use a prescription pad referral that's provided as a sample by Rebion, the manufacturer of the device. So highly recommended, well constructed. The unit costs about $9,000, comes with a 1-year warranty. If you have any questions or comments, please contact me at MedGizmos, and have a nice day.